Restrictions are loosened on youth sports in California. The late ruling from a judge that's changing the rules even more.
COVID long haulers are seeing signs of hope and a new treatment. Why heart medication may help those still suffering months after infection.
A local high school is working to help low-income families who want to send their children to private school. The unique work-study program helping students prepare for college while making tuition affordable.
ABC 10 News at 6 starts now.
After months of rallies and appeals to the state, thousands of families across California got some welcome news today. Governor Gavin Newsom has announced the loosening of restrictions on youth sports. Good evening. I'm Kimberly Hunt.
And I'm Steve Atkinson. Within the last hour, a local judge ruled that high school and youth sports can return immediately under certain guidelines. More on that late change in just a moment. But first, our ABC 10 News reporter Mimi Alcala explains what the governor announced today.
The long-awaited words have finally been spoken.
We are now confident with new guidelines that we're publishing today that we could get youth sports moving again in the state of California, get competition moving again.
Outdoor youth sports can resume in California starting February 26th under certain conditions outlined by the California Department of Public Health. A move the group Let Them Play California and San Diego coaches, including Torrey Pines football coach Ron Gladnick, have been fighting for.
Every politician who listened to the data, who gave us an audience, the almost 70 legislators who have joined us, thank you.
To qualify, counties must have a COVID-19 adjusted daily case rate at or below 14 per 100,000 residents. San Diego County isn't quite there yet. As of Thursday, we're sitting at 22 cases per 100,000 people. But Coach Gladnick is hopeful we could be at 14 by next Friday.
I had a long conversation with Nathan Fletcher this morning. We are dropping an average of 10 to 15 cases per 100,000 a week. From the county supervisor's perspective and county health, they don't see any reason that those trends are not going to continue.
The new guidance applies to all organized outdoor youth sports and recreation, including school and community-sponsored programs, privately organized clubs and leagues, and adult recreational sports. It does not apply to collegiate or professional sports, community events like marathons, half marathons, and endurance races. Infectious disease specialist Dr. Christian Ramers says while there's no way to completely remove the risk, low community transmission is key to safety.
In the right environment with a reasonable decline in community transmission and then done safely with all the measures we know work.
For high-contact sports like football, soccer, rugby, water polo, and boys or men's lacrosse, the state is requiring COVID-19 testing of players 13 and older and coaches. The state says it will pay for and provide the tests. Low and moderate contact sports will not require testing. Mimi Alcala, ABC 10 News.
And shortly after 5 o'clock tonight, a San Diego Superior Court judge granted a temporary stay on the pandemic restrictions for high school sports. Now, the judge ruled if college and professional sports are allowed, high school and youth sports should continue under the same guidelines as those professional sports. The next hearing on this temporary stay is March 5th. In the meantime, San Diego County's case numbers, they continue their downward trend. This is great news. Our rolling average for positive cases is hovering just above 5%. There were about 800 new cases reported today. That pushes our total to 255,000. Sadly, though, deaths still remain high. The county says 34 more people have passed away from the virus.
Vaccination sites all over the country are closed this weekend because severe weather in the east has delayed shipments of doses. And meantime, Governor Gavin Newsom is sharing what the next few weeks will look like for the state's allotment. He tweeted California's forecast through the next 3 weeks, saying there will be modest increases every week. Local vaccinators call it welcome news.
I think the projections are going to get a little bit more accurate. It's been a big complaint of vaccinators like us and like people running the larger sites that it's very hard to plan when we just don't have a good expectation of what's going to come.
San Diego County is still waiting on more than 50,000 missed doses going back to last week. Today, the federal government said it's ramping up efforts to get all delayed shipments where they need to go by the end of next week. And Governor Newsom says the state will start to set aside 10% of the vaccine doses every week for teachers. The governor said the move is aimed at reopening schools for in-person learning faster. Just yesterday, state lawmakers unveiled a $6 billion plan to reopen schools. Part of that plan includes guaranteeing that teachers and other school staff have access to vaccines. Right now, the governor's plan only accounts for first doses. They will be set aside starting March 1st. We know there are a lot of questions and different experiences with the vaccine rollout. Our ABC 10 News in-depth team is committed to tracking down answers and sharing your stories. Just send us an email at tips@10news.com.
A new study out of UC San Diego is offering hope for COVID long haulers. These are people struggling with mysterious symptoms months after their battle with the virus. Our ABC 10 News anchor Derek Stahl is going in depth to explain why a certain kind of heart medication may help.
Roughly 1 out of every 10 COVID survivors gets lingering symptoms like chronic fatigue, shortness of breath, and brain fog. Those are symptoms UC San Diego cardiologist Dr. Pam Taub is very familiar with.
When we started delving a little bit more in depth into the long hauler syndrome, what we see is they share many of the features of POTS.
POTS stands for postural orthostatic tachycardia syndrome. It's a fancy medical term that just means your heart rate shoots up when you stand up. It's most common in young women, and it's a condition Dr. Taub has been studying the last few years.
When you have an elevated heart rate, you get short of breath. Sometimes you have chest pain, you don't feel well, you're not able to stand up, you're not able to do your usual activities.
And then there's the brain fog.
When your heart rate is high, it's really hard to get things done. It's hard to focus. You can think about it as kind of a flight or fight response all the time. So basically what we have come to the conclusion is patients with COVID long hauler syndrome, especially if they have an elevated heart rate withstanding, have POTS.
Not every long hauler case is POTS. Some of those symptoms could be caused by blood clots or scarring in the lungs. But POTS is known to occur after an infection, including a viral infection that disrupts the immune system.
The theory is when you have an infection, you produce certain antibodies, and these antibodies attack the regulatory systems of the body. So systems that regulate blood pressure and heart rate.
This week, Dr. Taub published the first randomized controlled trial on POTS patients and a heart medication called ivabradine. The study showed the drug calmed their overactive heart rates without significant side effects. Ivabradine is already FDA approved for another disease, so doctors can do what's called an off-label prescription.
This is something that I have used with my patients that have COVID long haulers, and many of my colleagues across the country have done the same. And now that you have a clinical trial, it's also a little bit easier to appeal to insurance companies to cover the drug.
In other words, this study could save patients hundreds of dollars on the drug if it gets insurers to pick up the costs. She's hoping the data encourages more doctors to try the treatment, offering some COVID long haulers needed relief. Derek Stahl, ABC 10 News.
Face coverings and other forms of personal protective equipment have been among the most effective tools at limiting the spread of COVID-19. But as cases drop and reopening restrictions are relaxed, the need for PPE is still high. Today, our partners at KPBS spoke with a volunteer group whose main goal has been to make sure those who need PPE get it. Last Mile San Diego has been coordinating donations around the county. Organizers say the ambitious task has not been easy.
A distribution this massive was incredibly difficult to collaborate. We had to collaborate with multiple groups, including the Iron Workers 229, Murphy's Produce with Purpose, the Teamsters.
Today, the group helped deliver 76,000 containers of hand sanitizer and 2,000 infrared thermometers to the city of Oceanside. And the city plans to distribute those items to hard-hit areas in the North County.
President Biden's $1.9 trillion COVID relief package may get a vote on the House floor next week. Under the bill, Americans making $75,000 or less a year, they would get a one-time direct payment of $1,400. It also includes more money for small businesses struggling during the pandemic. Federal unemployment benefits will include a $400 a week increase, and there is more money for schools to reopen. After the House vote, Senate Republicans have said that they are worried the bill will bypass committees for a full Senate vote.
The first group of migrants allowed to wait for their asylum cases in the U.S. are now in San Diego. 25 people were let in today. All of them have been processed and tested for COVID. They are temporarily staying in a San Diego hotel. They're receiving shelter services and legal support from the San Diego Rapid Response Network. Before today, asylum seekers had to wait for their court dates in Mexico as part of the Trump administration's migrant protection protocols.
The sentiment over the last 2 years that the program's been in effect has been really one of desperation. They want to do things the correct way. They want to have their day in court.
The Biden administration plans on accepting 25 people every day from the MPP program Monday through Friday. In a statement, East County Congressman Darrell Issa called the decision to bring migrants into the country during the pandemic reckless.